It's Bridget Conry. It's Companion Botanicals. Bridget, thank you so much for giving us time.
You're welcome. I love being here. I look forward to it every month.
You and I, we could talk about all of the things that I'm doing in my newly plant-based life, but we're not here to talk about me today. We're here to talk about pain management. And so we're diving in, right? We're diving in on some conditions. And so where would we even begin the conversation around pain?
Right. And it's a big one, and so I thought that we would talk about it broadly a little bit at first and then focus in maybe on some topical herbal formulas just so that we can achieve something,
some sort of an end, at least for the time being. Exactly.
Yeah, because there are different ways to manage pain, and you can do it topically, you can do it internally, and of course there's the emotional aspect too. And so, our experience in the dispensary and as an herbalist, chronic pain is one of the main reasons why people are seeing us. And if it's not the qualifying condition, there's usually pain associated with whatever qualifying condition they have. And then there's just normal health and wellness stuff that people who aren't patients in a program, they're looking to address pain. But as an herbalist, you would kind of go through and do a full consultation, to try to, isolate where the pain is being felt, where is the location of the representation of it, and then what are the sources of that pain. And usually there are many, and that's why chronic pain is really hard to get to. That's why people are really grabbing at whatever they can to try to deal with it, because it's an epidemic, I think, in our country. And there's lots of reasons for it. You can have pain because you have a disease. You can have pain because you have an injury. You can have pain because of diet and lifestyle. The things that you consume can cause chronic inflammation that causes pain. You can have pain because of posture, or repetitive motion or things like that cause inflammation. So there's lots of reasons for it, and trying to, get to the bottom of it is really important. I think that one that people, I know you want to get in there. One that
I was just going to say, get to the bottom of it or the top of it. I was going to do that for the topical.
Yeah, and well, the top of it too, I think that a lot of people disregard is the emotional aspect of pain. And so lots of people have trauma, they have stress in their life, and that gets manifested as physical pain, depending on how we process it or we don't process it. And there are studies out there that show that anxiety amplifies pain, and so
or the other way around. My wife, right. Will carry her heavy bag, and then her shoulders are hurting, and then that affects her emotionally, without question.
Totally.
So, all right, so let's try to solve some of these things as far as localized pain. How are you going about it? How are folks going about it? What are some do's? What are some don'ts?
Yeah. So before we get into the herbs that work really well in combination with cannabis for topical preparations, I do want to say that, speaking to that emotional aspect again, is that one of the things that cannabis does for pain, no matter what the source of it is that it helps to dissociate from it. And it's something that we hear again and again, is that euphoric aspect that THC grants everybody, or depending on the product that you're taking, is that it may not actually be that the THC is physically interacting with your body and causing that pain to go away because it did something internally to interrupt a pain signal or something in your nervous system. It's that it allows you to not be thinking about it anymore because you're in a different place. And one of the things that happens when you have chronic pain is that you're thinking about it. It's central in your thoughts all the time. And if you can remove that, it lessens the experience of it and allows you to move on with your life and have a better quality of life, even though there might be some pain that's still there. And so I think that's one of the greatest gifts that cannabis does. And I think about that a lot because we were in Israel together. Last time we were there at the Canatech thing, we went to Lumiere Labs. And I'll always remember what Lumiere worked with Meshulam. Yeah. And I think he actually identified 2-HE. That's what Meshulam put him on. But he talks about the gifts of cannabis is it helps us to eat, to sleep, to relax, to forget, and to protect. And it's really important to be able to forget. It's one of those things that people criticize cannabis for, is that it decreases your memory or whatever, but it's really important to be able to forget sometimes that your pain exists or why it exists so that you can function.
That's it.
So that's like cannabis on a THC on its own is so powerful for relieving pain for that reason.
Yeah.
So
and just as qualifiers, just to remember your lesson here, we can turn to Parliament Funkadelic with Free Your Mind.
Oh, yes.
Right. And Pink Floyd with a momentary lapse of reason is okay. Right.
It's okay. Yeah.
Yeah.
Unconsciously. So you can use, THC products, even if you're dealing with, that are ingestible or inhalable as opposed to topical, to help relieve topical pain, because it's doing that in the background. It's helping you forget about it. And then you can work with salves or creams to address localized pain conditions. And sometimes, the obvious examples are like arthritis or injuries that you might have, inflammatory skin conditions and things like that. And so you can find success again if you're just dealing with cannabinoids in a very simple base, and if it's a salve, it's going to be with a wax that's involved in there with a certain kind of oil. And the thing that's important about salves is that that wax allows the active ingredients to kind of stay put on the skin longer. And so it like keeps the active ingredients where they need to be. And it's particularly helpful when you have like a wound or some inflammatory skin conditions for that to happen, instead of using like a cream that absorbs really quickly and doesn't stay where you need it. And so salves can be very helpful for that. Some people don't like them because they do have that greasy effect, right. And creams absorb more easily. And so you can use a basic salve or lotion that just has a wax or certain emollient oils in them and just have CBD or THC in them, and they work. And we think that we know how they work. What the theory is that they're interacting with the CBD2 receptors that are in our derma. And that's why they're pain relieving and anti-inflammatory. But we're still trying to figure all that out. But the science looks like that's why it's happening, that THC or the CBD is interacting with our nerve endings that have CBD2 receptors in the skin.
We know enough that that's probably true. We're pretty sure, right? Yes. So we're getting there.
Yes. And so again, our whole theory here, our whole thesis is that, hey, cannabis can do great things on its own, but it could possibly work better if it has other companion botanicals with it. And so, so there's a whole bunch of different herbs that you can use, and people are starting to do it. And I love to see this now. And I think topicals are actually the place that you're seeing it the most, because in some ways it's easier.
Sure. And if it's not ingested, it's a whole different set of regulations, right?
Yeah. That's a whole, yep. And also I think people are used to using salves and topical products more than they would be a tincture or something like that. And they've used an arnica salve before. They know what that is. And so now they're like, oh, arnica, I know that's good. And it helps with my pain and swelling, and THC and CBD in there. Great. So it's a nice starting point for people. And so obviously arnica is a big one. St. John's wort is another one that's usually used, and that's specific for for inflammation and pain. But one of the things that you want to think about, and again, like the reason why you're having pain in different places, there's different reasons for it. And oftentimes it's either due to a heat situation or a stagnation situation. And usually stagnation means that there's not good circulation, it's got cold associated with it. And so if you're dealing with an inflammatory condition, you're going to want to choose herbs and base oils that are cooling. And if it's something that is due to a cold condition where you don't have good blood flow and things, you're going to want to use something that's warming. So base oil right off the bat, super important. And I know they're not herbs, but they're plants. But they come from plants, and so coconut oil is used a lot because it's very cooling on its own. Sesame oil would be a great choice if you were looking to warm up a situation to provide healing. So those are the first things that you would consider. What are the base oils? And then you can start looking at cooling herbs like chamomile and eucalyptus and yarrow and chickweed. All of those are anti-inflammatory, they are analgesic, and they're cooling at the same time. And then on the warming side, you can go into pepper and ginger and birch and wintergreen and all those things that help to create heat. And sometimes you need both, and that's where you see like icy hot things. Basically the icy hot's got like menthol in it and like capsaicin. Capsaicin is an active ingredient that they pull out of chili peppers that's analgesic and warming. And so together in the formula, that icy hot thing, sometimes that's what does it to relieve pain. So those are some of the things that you want to consider when you're looking at how you would approach what herbs would be better for my situation, whether it's, arthritis or if it's psoriasis. Well, psoriasis.
Sure. Yeah.
Eczema, things like that, or swelling due to an injury or due to, a cancer condition that's causing edema somewhere in your body.
Well, let's go ahead and put you on the spot. I fractured my distal tuft. Do you know where that is?
No.
It's the fingertip, right? So this guy's fractured. You can see the fingernail is pretty not so great. Hasn't started growing back yet, but I had a little bit of a brace on because the doctor told me to do that. Now he told me to take it off. I'm doing some hand exercises, but you can see because it was so long out in the cold with no, glove, there's some dry skin there. But what would you suggest for something like this? I'm putting you on the spot. Do you mind if I do that?
No, I don't mind you putting me on the spot.
Yeah.
That one is particularly difficult because it's under your nail bed right now. So it's hard to get to.
Right.
But that is right there now. I mean, that's a bruising situation. And it's a stagnant situation because you've got stuff there that's not moving. So very basic level again. I have not done a full consultation with you or anything like that. Right. I would use arnica, which helps to move things. It's really a good blood mover and inflammation and where there's pressure. And I would use some of the warmer things in there. So I would go with something that had ginger or clove or birch in there that might try to help warm that up and move it out. Are you in pain because of that right now?
I would say people keep asking me this. Not everybody. Just really my wife and father. But no, I'm not in pain. I would call it at times discomfort.
Yeah.
And
it's because of the pressure probably underneath the nail that's pushing it up.
That's it. Yeah. And I mean, if I'm going to break a bone, this is the bone to break. I would rather it be on my left hand than my right hand, but this beats a femur, no question, right?
Another thing that would be really good is just massage.
Okay.
Gentle massage to help move things there with a massage oil or something that has a little bit of CBD in it and some of those warming essential oils. That would be nice.
Huh. Well, we will take that under advisement. Bridget Conry, the knowledge just flows from you. I love these. Thank you so much for your time. I really appreciate it. And I can't wait for the next one.
Awesome. Thank you very much. Take care.